joining me today. We are going to talk about anatomy and physiology today in our Ch.1 book. And for some students that have their Ch.1 book, I have all my beautiful markers up there on the board. Okay. All right. So we're going to be talking about Ch.1 today, chapters 1 and 2. And chapter 1 deals with healthcare terminology. Chapter 2 deals with the directional terms of the anatomy and physiology and why we need to use them. Okay? All right. So we're going to go straight to the board here. I'm going to discuss from my previous lecture notes that I've done before. All right, so I want to ask a question, and I'm going to write it on the board here, starting from this side of the room. Physiology. Okay, chapter 1. If the picture is not quite as clear as you need it to be, I'm not sure how to work this video, but if you can bring it in as best as you know how, that would be awesome. Okay? All right, so chapter 1, we're dealing with healthcare terminology. Okay, and the question that I had earlier today is, why is healthcare terminology important? Okay, so why is healthcare terminology important? Okay, so healthcare terminology is important for documentation reasons, okay? It's important to understand what goes in the electronic medical record as well as what goes on in the electronic health record, okay? So you have to understand healthcare terminology. So let's put it over here for one reason, and main reason only, is for documentation reasons only. Oh, well, not only, one of the reasons, for documentation reasons. For patient healthcare, or patient healthcare settings, okay? What I'm going to do is I'm going to pause for a minute and remove this plug because it feels like it's going to be a hazard for me. So just give me a minute. Let me pause. See here. Okay. 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 All right. I don't know if it took or not. So we'll figure it out. Okay, great. So it is done for healthcare reasons, okay? for healthcare settings. Now, in a healthcare setting, you have the electronic medical record, you have the electronic healthcare record, okay? And in between these is the RHIO, okay? So what I'm going to do is draw a small diagram of the RHIO and tell you how all that relates to one another. Okay, so we have this wonderful thing called the circle of life. And in the middle, you have the RHIO, okay? And the RHIO plays as a portal, okay? It plays as a hub. Now, you're probably asking, well, Ms. Harper, how does this all play together in healthcare terminology? I'm glad you asked. I will share that with you because in documentation, you have to understand the lingo of what's being said, and the lingo of that documentation is for healthcare workers such as nurses, doctors, and alike to understand what we're saying, not for patients or common lay people. It's for us for documentation reasons, and it's to keep down confusion of those who don't understand, but you need proper interpretation and understanding from the healthcare worker to tell you what's going on. It's not a hidden secret or a mystery. It's just documentation, and it's legal and it's binding, and we have to do it that way. Okay, so through the RHIO, through the portal, you have Memorial Hermann. Okay, you have Memorial Hermann. All right, and you have Dr. Smith's office. Okay, so Dr. Smith has an EMR. Okay, and Memorial Hermann has an EMR. Okay, now let me give you a proper definition about EMRs. Okay, well, a definition that you can relate and understand. Okay, so with EMRs give you access on a personal provider level, but limited. Okay, electronic health record gives you access on a broad level, broad provider level, but unlimited access. Okay? Okay, so EMR is more limited, electronic medical records. EHR, electronic health records, is more broad. So let's go back to the circle over here and let's reiterate the understanding. Okay, so right here, I have Memorial Hermann Hospital. They have their EMR, and let's name a patient. What name can we give a patient? What name can we use for a patient? Can we name Lynn? Okay. So let's suppose Lynn. Let's suppose that Lynn was seen in the ER, okay, for a fractured arm, okay, was seen in the ER for a fractured arm, okay, and let's suppose he was seen, let's see here, May 15th, okay, so they took care of his fracture. Let's suppose he had a closed reduction type fracture, okay? And when you get ready to learn medical medical procedures, you're going to understand, especially on an acute care level, you're going to understand what open and closed reduction means. So open reduction type surgery is when the bone has popped out the skin. When the person's fracture has been so detrimental that their skin the bone has broken through the skin. Okay, that's open. Okay, that means the doctor has to go in and put in pins and some all the artistic things he needs to do to help the healing process of that bone. But since this is a closed reduction type fracture, that means that patient, he fractured his arm, but the bone did not break through the skin. It's just broken underneath all that flesh and muscle and tissue. Okay, so he had closed reduction surgery. Okay, and that's how the doctor did that. And they immediately took care of it in the hospitals. Okay, so now today is what, June 4. Okay, he's been in the hospital for about maybe a week. You know, he may have some other predispositions going on with him, and he may be diabetic. So he's got some healing issues, and that's why he has to stay a little longer for the healing process to take place the way it needs to take place. Okay, so now he's going to see the doctor for a follow-up. Okay, and he's going to see an orthopedic doctor for a follow-up. Okay. Okay, fantastic. Okay, so all of his EMR has his, let's put it in red over here, and it mirrors kind of the same thing. It has his SOAP notes. It has his patient demographics. Okay, it has all the radiology and lab notes. It has the physician and nurses notes. It has everything you need to know about this patient. Okay, over here, Dr. Smith's office is going to mirror the same thing. It's going to have SOAP notes. It's going to have patient demographics. Okay, it's going to have radiology and lab. And it's going to also have physician and nurse's notes. Okay, now this is their personal chart. Okay, so let me give you an example by what I mean. Okay, so this right here is Memorial Herman's electronic medical record for Lynn at the hospital. This is Dr. Smith's electronic medical record for Lynn at his office. You have two personal electronic medical records for a facility and for a doctor's office. Okay, did you understand that? Now, how will that information communicate? How will the information from the hospital, Memorial Hermann, communicate over to Dr. Smith's office? I'm glad you asked. It communicates by way of a portal. Okay? Have you ever taken chemistry in school? High school. You never took chemistry in high school? You never took chemistry in college, maybe? Okay. Well, it's kind of something like this. Okay? For those that have taken or are familiar with chemistry, I'm going to explain it the best way that I can remember from my heyday. Now, here you have one chemical compound here, okay? And you have another chemical compound here. But if you pull them together, they're connected together by bonds, peptides. I want to say peptides, which kind of links them together. And when they're linked together, they make another chemical formulation altogether, okay? So that's how that works. But by way of communication, in the middle is the portal. And that is the RHIO, the Registered Health Information Organization. Okay, it's communicating one medical record from over here and one medical record from over there. But inside that hub of the RHIO is called the Electronic Health Record. Okay, in the middle of these two papers is kind of figured out as the electronic health record. So in that hub of the RHIO contains broad information. Okay, you're not going to get every piece of information about that patient. Okay, on a EMR level. On an EHR level, you're going to have access to the patient's name, the demographics, what insurance that they have, a copy of their driver's license, their health insurance card. You're going to have those things, okay? And so that way, when the patient goes to see Dr. Smith and he has hospital privileges with Memorial Hermann, or maybe he has hospital privileges with St. Luke's, or maybe he has hospital privileges with Methodist, and on an EHR level, through the RHIO, he's going to be able to pull up the patient's name, insurance card, ID, where he lives, his social security number, everything to kind of help shorten the process. All that person has to do at the doctor's office is verify the patient's name, the patient's insurance, and their birthday. Although they do have to complete forms, the way that they completed forms over here at the hospital, they still have to have their own stack of legal forms to complete. It just shortens the process of the insurance verification specialist and the front desk person for putting the information in. And plus, who knows? Things could have changed right after that. Lynn got out the hospital. Things could have changed by the time Lynn gets to the doctor's office. Things could have changed, okay? So that's why it's always necessary to update information every time a patient comes in on a short stack type of application, okay? Great. Does that make sense? Yes. Okay, great. So again, you have one EMR that's personal for Memorial Hermann and another EMR that's personal to Dr. Smith. Now, let's talk about what goes inside these EMRs, okay, on a much deeper level, okay? All right. Now, on the EMR, we just got through explaining, or we just finished explaining that you have the patient's demographic, okay, their name, their address, their driver's license number, their social security number, their insurance card, a copy of the Texas ID or their Texas driver's license, things of that nature that makes them pertinent to who they are to reach, okay? Then you have their SOAP notes. I'm going to put here SOAP notes, okay? All right. So all this is comprised in the EMR, and I'm going to be kind of like all over the board. So you're going to have to kind of follow me really, really close. Okay. So for SOAP notes, and remember, class, we talked about earlier in the other class, SOAP notes. Okay. And so another name for SOAP notes is progress notes. Progress notes. Okay. All right, fantastic. All right, so SOAP notes, you have subjective, you have objective, you have assessment, and you have plan, okay? All right, so whose conversation is going on in subjective? I'm glad you asked. This conversation belongs to the patient and the nurse, okay? All right, so the nurse is going to ask the patient, CC means chief complaint. What are you coming in for? Oh, I'm coming in for a follow-up for my fractured arm, okay? I had a procedure which was a closed reduction procedure, okay? All right, and he had it done on May 15th, okay, at, what did we say, Memorial Hermann Hospital System. Okay, great. All right, and so she's gonna say, okay, great. So let's see here, let's take your vital signs. Okay, so we need to record the vital signs. That's what the nurse is going to do, which is temperature, pulse, respiration, blood pressure. Okay? All right, great. And so he's going to ask, the nurse may ask on a scale of 1 to 10, what is your pain level? He may say, well, I feel fine right now, but my pain level every now and then may be a 3. It's a 3. So now I kind of have to feel okay. She's going to say, okay, great. Okay, well, the doctor is going to come in and see you in a minute. I'm going to leave you in here. So the patient says, okay, great. So now the doctor comes in, and objective is the conversation between the patient and the doctor, okay? And again, he's going to ask him for himself. You know, sometimes patients tend to open up to their doctors a little bit more than they would to the nurses. It's simply because maybe because they're a physician, maybe because they have MD behind their name and they felt like they could hear a lot better and be heard a lot better. So that's why they tend to do that. So the doctor says, okay. I see that you're here for follow-up. Yes, I did do your surgery at Memorial Hermann. Okay, you have a pain level of 3. Well, how's that Tylenol working out for you? Oh, it's not enough? Okay, maybe we need to give you some vitamins. Okay, great. Okay, we're going to start your physical therapy. Have you started physical therapy yet? No, you haven't started? Okay, maybe it's a little bit too soon. We'll start it down the road. Okay, great. So then the doctor says, I'm going to test your hands. I want to see how the nerves are in your hands. Okay, so he's testing for his nerves. Then he's going to test for his muscles in his hands and in his wrists. Okay, the muscle system. Okay, and then he's going to see how is his skin doing, and then he's going to check for his heart, cardio. Cardiovascular system, pulmonary. Well, same thing. Okay, so he wants to make sure that the patient is doing okay. So he's going to do what you call a review of systems. Now, there's 12 systems of the body. Some say 13. Depends on how you want to divide the reproductive system, but there's 12. Okay? And so out of the 12, he's going to check 1, 2, 3, 4. He's going to check 4 out of the 12 systems of the body. Okay? And after he checks that part, then he's going to ask the patient some more questions. So he's spending an amount of 30 minutes with the patient. And he's going to give a diagnosis of fractured arm, arm pain. Okay. He spent 30 minutes with the patient. Okay. His plan for the patient is to get physical therapy in 3 weeks, return to office in 2 weeks. He's going to give him some Vicodin. He's going to love that. And he's going to have him to light duty. Okay, he's a teacher. He needs to go to work. He's used up a lot of his sick time already. So it would be more beneficial for him to go to work, but just do some light duty. Nothing strenuous, just some light duty. Okay, great. All right, so now all of this is under assessment. I'm going to circle off assessment, and I'm going to explain to you why did I circle off assessment. Okay. Here, 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 here. Okay, here. Okay, now I have circled off assessment. Now, you're probably wondering, well, Ms. Harper, why did you circle off assessment? I'm glad you asked. I circled off assessment within the SOAP notes because assessment on outpatient coding is the main job responsibility that we have to do as medical coders and billers. Okay, we tend to look for our diagnosis codes and our procedure codes. Now, does the doctor know the procedure code? Rare. Does the doctor know the diagnosis codes? Rare. Okay. He may write out the word fractured arm. He may write out the word that I spent 30 minutes with this patient with 1, 2, 3 different variable of reasons. Okay. That's great. Our job is to convert words into numbers. Convert words into numbers. Okay. So this right here, this is a diagnosis code. So we're going to convert both of these into a number, into numbers. This right here, 30 minutes, is a procedure code. We're going to convert this over into numbers, okay? Now, again, you're probably asking, well, Ms. Harper, why is healthcare terminology important in all of this? So that when you read what a doctor has written about a patient in assessment, when you read the notes that the nurse has said about the patient in subjective, when you read the information of the discussion that the doctor has had with the patient, then you're going to understand the notes. You're going to understand the terminology. You're going to understand the lingo. You have to imagine as if you're on medical terminology island. And on medical terminology island, you have to talk a lingo of medical terms that only you and other healthcare professionals know that everyone else don't know. That's not part of the island, okay? So I'm on medical terminology island. She's on medical terminology island. Some more of you that's taking these healthcare classes, you all are on medical terminology island, okay? Very good. All right, now, do you need to know the plan information? Yes, it's pertinent, but it's not quite necessary. But it is pertinent. It's going to help you understand when you get ready to bill the next time what was going on the last time. Okay? So that's a fail-proof way of understanding documentation. So going back to my notes here, I'm going to switch chairs out for a minute. Nice cool air. Okay, so what does this mean? Documentation. You have to understand documentation in all of its glory. All right, so let's look at some more notes that I've written here. I've written a plethora of notes for different reasons. Okay, also for documentation, you have to understand the directional terms. You have to understand sagittal, left, right, anterior, posterior. You have to understand if it's hypo, hyper, supra, supro. You have to understand all those terms so you can understand exactly how to code. If you're going to code for a patient that may have had gallbladder surgery, okay, and within that gallbladder surgery, the doctor discovered that there's a mass on the large intestine. So he's got to call in a gastrointestinal doctor who deals with large intestines and have that tumor looked at while he's within that same opening. So are you going to code twice for one opening? No. You're going to code one time. And a lot of times you're going to find out eventually those are called global, okay? So when you get ready to do some billing, that's all global. It's called a global package. So within one laparoscopic opening, it's a whole plethora of things that took place, okay? Okay, fantastic. All right, so another reason that you need to understand medical terminology is because you need to understand the root words. So let's look at that. Oh, here we go. Right there. Here we go. Oh, number 2. Prefix and suffix. Okay? And its combining forms. Okay? Now, going back to elementary school, do you remember going back to elementary school? Okay, great. So going back to elementary school, you learned all of your root words. So I'll give you one in medical terminology island. Okay? Cardi. Cardi means what? Anybody have an idea what cardi means? What does cardi mean? Heart. Cardi means heart. Okay? So we're going to say the word logy. What does logy mean? L-O-G-Y. Study up. Very good. So study of the heart. Okay? So, but if it's logist, L-O-G-I-S-T, that means a specialist of the heart. Okay? So it's real important to understand the root words, the prefix, the suffix, and the combining forms. And that right there makes it very important to understand healthcare terminology. You cannot function as a medical coder and biller without totally understanding that. I'm not saying you're going to memorize it, but you need to know the foundation. Once you learn the foundation of everything you need to know in your field, the medical terminology, the CPT code, the diagnosis code, all those beautiful things, then you will have a great appreciation for furthering your education, furthering your mind, furthering what you need to know. Okay? All right, fantastic. Okay, so what we're going to do here, we're going to take a break and we'll be right back, okay, with chapter 2. Okay, do you have any questions for me? Okay, fantastic. So we're going to go over some medical terminology words and we'll talk about that and we'll be right back with chapter 2. All right, thank you so much.